Hello everybody, today we'll be discussing the third issue of the list posted on the anatomy department. This is the third point out of 164. Here we're going to discuss the sternum and the ribs later on. To begin with, quickly, the sternum is made up of three parts: the manubrium, the body, and the xiphoid process. The manubrium is the most superior part of the sternum. The body here is found between the manubrium and the sternum, and between the manubrium and the Xiphoid process. So here we need to know that there's a joint right here. It's called the manubrio-sternal joint, and here is called the xipho-sternal joint. Okay, just to let you guys know where the sternum is, it's found on the anterior aspect of the thorax. Of course, it is attached, or a major attachment, for ribs. Here, the manubrium is attached to the first rib on those two aspects. Then we have the second rib that joins the sternum on the exact location where the joint is, the manubrio-sternal joint, where the facets of the anterior parts of the rib articulate with the demifacets. The demifacet of the manubrium and the demifacet of the body of the sternum in this part right here. Then we have rib number 3, rib number 4, rib number 5, 6, and then finally number 7 joins on the joint called the xipho-sternal joint right here. Okay, so these are just the major characteristics of the sternum. When you talk about the sternum for Professor Swirsky, you have to be very general. And when you talk about a bone, when you start describing a bone, you always have to say what type is it, beginning your description. So here the sternum is flat. It's a flat bone. As I said, it's made up of manubrium, body, and xiphoid process. Okay. Through this guide, if you decide to purchase this guide in the future, and I hope you do, because it is really very simple to follow, and I will use it throughout my videos, so that you can follow along as I explain. Why it's important is because it doesn't only give you the important aspects, but it gives you some more extra information so that you can wrap around your knowledge of anatomy. So here, it gives you some of the posterior relations of the manubrium, such as the superior vena cava, the aorta of the arch of the aorta, etc. That's posterior to the manubrium, just at this level. And then it also gives you some attachments of some muscles present, such as the pectoralis major to the anterior part of the manubrium, and then such as the sternothyroid in the posterior surface, or the sternohyoid of the manubrium at these regions specifically. You will learn about those muscles in the future, but it's nice that you can just have some things to tell Swirsky if he points out to give you to ask you for more information, and that's why this is useful. Okay, the body of the sternum, as I said, is a major joining of so many ribs, such as the first, the second rib, third, fourth, fifth, sixth, and part of the seventh. Okay. And also gives you some posterior relations of the body of the sternum. You do not have to really be specific with everything around the sternum, but the more knowledge you have, the more easier for you to be answering the question and showing that you have a more well-rounded answer. Okay, so yeah, if you face a point like this, it's always nice to read even further and see where's the sternum, what's around the sternum, what's behind the sternum, okay, what's behind the body of the sternum, what's behind the body of the manubrium of the sternum, what's behind the xiphoid process of the sternum. Sometimes I like to also see at what level corresponds what level of vertebrae corresponds to the level of the sternum. You see what I mean? So let's say Xiphoid process is at level of T10, thoracic vertebral number 10, or like the xyphosternal joint is at level of T9, so that I can be specific, so I can show him that I know those things. Okay. What else? Let's see. Yeah, so this image here, right here, you will be studying more about it when it comes to the pleura of the lungs, or the levels of the lungs. The lungs in general and the pleura around it do cover a big part of the sternum right here, and it kind of forms the anterior border of the pleuras. If you see right here, it's very nice to know exactly what the sternum is corresponding with and stuff like that. But if you say manubrium, body, xiphoid process, it's very enough for you to be saying the details of the sternum and then what attaches to it. One more very important feature about the sternum is that the clavicle attaches here at the clavicular notch. So it's not only the point of attachment of the ribs, but also the clavicle. And we will explain what the clavicle is when we talked about in the future, when we talk about the upper limb or the pectoral girdle. Okay, so that's the sternum, manubrium, and body. Now for the xiphoid process. The Xiphoid process is the ending bone of the sternum. You can actually touch it with your hand. I don't know exactly what I should be saying here, but you can feel it, and it's palpable. Just as you go down your rib cage, just on the superior border where you think your stomach is, that will be the Xiphoid process. And the Xiphoid process, as I told you, is connected to the sternum by the xyphosternal joint and is at the level of T10. The Xiphoid process makes up a very important attachment of the linea alba. And this is a very important structure when it comes to the rectus abdominis muscle, and you will get to learn about it in the future. So the linea alba extends from the Xiphoid process down towards the pubic symphysis. So that's the Xiphoid process. So yes, so as I said, to summarize, the sternum, manubrium, body, Xiphoid process, the attachments of the ribs of it, and the clavicle on top. Okay, that's for the sternum. One important thing that I want to mention is that at this part right here, and you will learn about this in your practical issues, as you study for your orals, there will be a practical exam before the oral exam. And sometimes in those issues, I've seen a lot about the sternal angle. This is a palpable position on your chest, and it's you can actually feel it once you know the position of the manubrium, and then at the edge where the manubriosternal joint is present, you can feel a palpable structure here in the course of the sternum. So that's the sternal angle. Okay. Next, we're gonna speak about the ribs. So the ribs in general, what Sureski likes to hear is that you mentioned that there's 12 ribs by name, but then 12 on each side. Okay, so we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then 11, 12 are on the back. So when you describe the ribs, you want to say the classification according to the relation to the sternum, or also after mentioning that, you say the classification according to the relation to the vertebral column. So this is important because you want to show him that I know what type of ribs are there, and how many classifications are there according to the general features of it. Okay, so I'll explain in detail more. So true ribs, you have first classification, true ribs. These mean that they have their own costal cartilage. So you see, for example, the upper 7 ribs, 1, 2, 3, 4, 5, 6, 7. If you see that they're literally independently attaching to the sternum, these are the true ribs. Okay, the false ribs are 8, 9, and 10. You see that they don't really attach to the sternum, but they attach to the intercostal cartilage of the 7th. So that's why they're called false. They don't really attach directly to the sternum, but they attach. As I said, the false ribs, they attach to the intercostal cartilage of the 7th rib. 8, 9, and 10 attach to the intercostal cartilage of the 7th. This is what a false rib is. Floating rib, 11 and 12, they don't attach to anything on the anterior aspect except for the posterior aspect. They're attached to the vertebrae. They're just floating. Okay, 11 and 12. Next, we're going to talk about typical ribs. They're 3 to 9. Non-typical ribs are 1, 2, 10, 11, and 12. Anything that typical ribs may contain as features, non-typical ribs are called non-typical because they deviate away from that standard form of features that they contain. So a typical rib, according to this definition, on the posterior aspect, as it articulates with the vertebrae, you have this is a thoracic vertebrae, and this is a thoracic vertebrae, and this is an intercostal, intervertebral disc, sorry. So it will articulate with the superior, the inferior, and the intervertebral disc between them. Okay, so it has 2 articular surfaces, number 1 and number 2, that articulate with the superior demifacet of the superior vertebral thoracic vertebrae, and the inferior articular facet articulates with the demifacet of the inferior thoracic vertebrae. Okay, plus the intervertebral disc. For a non-typical rib, they usually articulate this way. The rib articulates with the same number of thoracic vertebrae. So for example, number 1, first rib articulates with the first thoracic vertebrae, but it doesn't articulate with the intervertebral disc below it or the thoracic vertebrae below that. Okay, so that's just a general idea. We're going to discuss now the general features of a typical rib and the non-typical rib, and then see how they differentiate. A typical rib contains anterior aspect and a posterior aspect. First, we're going to discuss the anterior aspect and how this aspect is attached to the sternum. It does not really attach to the sternum directly. Rather, it contains a costal cartilage. Sternum, costal cartilage, rib. That's the anterior aspect. Okay? The posterior aspect, on the other hand, contains an upper facet and lower facet. These are found on the head in the posterior aspect of the rib. Then the rib on the posterior aspect contains a neck, and a tubercle. So these are the 3 structures that you want to know on the back. So 1, 2, 3. Head, neck, tubercle. Now the shaft contains an angle and it's very curved, and hence you see that the thoracic cage is shaped that way. Okay. Looking at the posterior aspect, which is this part, we see how it interacts with the thoracic vertebrae. Like I explained here, right here. This is just a drawing of it. Okay. T4, T5, intervertebral disc between them. You see that the head contains a superior facet that articulates with the demifacet of the superior thoracic vertebrae. And an inferior articular facet articulates with the inferior demifacet of, let's say, T5 here. And also it articulates with the intervertebral disc. Now, the neck is connected to the transverse process of the vertebrae of the same number. Remember, so if this is rib number 5, T5 transverse process connects to the neck of this rib by ligaments called costotransverse ligaments. Okay. The tubercle is formed of 2 parts, but it's not really necessary. Just know that what it is attached to. It articulates with the transverse process of the vertebrae of the same number. And also, the lateral costotransverse ligament connecting it as well. So, in general, you have to know that the head articulates with both the vertebrae up and down with the intervertebral disc, and then the tubercle articulates with the transverse process, or both the neck and the tubercle articulate with the transverse process, and they're connected to the transverse process by ligaments, and they're mentioned here. Okay, this is the articulation of the typical rib on the anterior side, the posterior side, and we explained a little bit about the shaft. Okay, non-typical ribs, I don't want to go into this very deeply, but just as I told you, first rib is a non-typical rib. Why? Is because it deviates away from having the same features as a typical rib. Here it has 2 facets. Here we can read that it has 1. That's a good reason for it to be a non-typical rib. Okay. Next, we have the second rib. It's twice as long. And just give me a second. Where was I? For the second rib, you can see it describes a little bit of an off structure. The surfaces are intermediate in direction between the surface of the first rib and the surface of the typical rib. So it's just like very unique of its own kind when it comes to these surfaces and the directions of them. That's for second rib. Now the 10th rib, it may look like the 9th or the 11th. And it only has 1 facet. You see? So those things can make a rib look as a non-typical rib, because a typical rib contains 2 facets. 11th rib and 12th rib, they are non-typical because of no neck, no tubercle, no angle. So these unique features causes a rib to be non-typical. So in general, when you're asked about ribs, talk about their attachments to the sternum, classifications as true, false, floating, typical, non-typical, the features of a typical rib, and how it's attached on the anterior aspect, how it's attached on the posterior aspect, okay? talk a bit about its shaft and angle and stuff like that. Just learn the general features of the rib. And then the non-typical ribs, what are they? 1, 2, 10, 11, and 12, and why they are called non-typical ribs. Okay, thank you very much. This is the end of the video. Sternum and the ribs make up your own beautiful speech as you have been guided today with a beautiful, I hope, it's a beautiful video. And as I said, keep repeating. Once you've got everything in one place, repeat it for 17 times before moving on to the next issue. Okay, thank you guys, and have a good day.